Hello, everyone. My name is Christopher Dankosik, and today we are going to be going over the top 5 questions about obstructive sleep apnea, featuring our distinguished guest, Dr. David C. Earle. He is a sleep therapist at a local clinic in Albuquerque, New Mexico, and he was kind enough to spare us his time and knowledge to go over these questions. These questions I derived from several different forums, um, and really just seeing which ones are the most common questions that people ask. So these questions are directly from users and the ones that I think would be the most helpful in terms of the questions I see most asked by patients on these forums. If you're interested in supporting this kind of content, head over to our website, medisource.tech, where you can sign up for our email to support our mission, where we send out regular emails informing you about current developments for our current projects, and also a support page where you can take a free survey, and if you're feeling generous enough to donate to the cause, as we're doing this out of the goodness of our hearts to try and give you guys good medical information straight from doctors. With that all that being said, enjoy the video. My name is Christopher Dankosik. I'm an electrical engineer by trade and obstructive sleep apnea patient myself. And David, if you want to go ahead and introduce yourself.
I'm David Earle. I'm a sleep medicine physician and also an obstructive sleep apnea patient.
Okay. So yeah, I guess let's just jump right into it. So first question is, how can you tell if you or a loved one have obstructive sleep apnea?
Well, common symptoms of obstructive sleep apnea would be things like snoring, stopping breathing while asleep, snorting, like a stop in breathing and then a snort or loud snoring, restless sleep, which is not necessarily specific but can be a symptom. For older people, it can be needing to urinate more frequently at night. That's not necessarily specific either, but 3 or more times of needing to urinate at night can be one of the only symptoms an older person may have. Um, a note on snoring. Snoring's not normal, but not all snoring is necessarily a catastrophe as far as, untreated severe sleep apnea or something like that. But that is definitely a sign and symptom.
So yeah, just to follow up on that. So obstructive sleep apnea. So what's the difference between that and what you just said, snoring? Because obviously they differ in severity, right? So like how, where's that line drawn exactly to know if it's like serious enough to be considered that?
Absolutely. So snoring means that there's some sort of interference in the flow of air, from the nose or mouth, ideally through the nose, although a lot of people with untreated sleep apnea will be what we call mouth breathers, sometimes with their neck extended to help themselves get air in at night. And if there's some sort of resistance, usually in the area where the back of the tongue is, although it can be other places, the patient or person may snore. Um, when diagnosing sleep apnea, there are kind of 2 sets of criteria that we look at. The most important is there's a interruption in breathing or decrease in flow of air into the lungs that results in oxygen saturation drops. And an oxygen saturation drop of 3 or more% is considered criteria for an obstructive event. There's also criteria that if there's a decrease in airflow because of resistance, person's not getting enough breath in while they're asleep, usually on their back, and it causes an arousal in their brain, which affects their um, sleep quality. That can also be scored. And so typically we have numbers referred to as apnea or hypopnea index. And depending on how high that number is, depends on if we consider it normal, mild, moderate, or severe. Another symptom that may happen, especially if a person's having a lot of fragmentation in their sleep quality, is they may have excessive daytime sleepiness. Sadly, it's not specific because, particularly in Western societies, a lot of people have insufficient sleep. Remind you all that a normal adult should sleep somewhere between 7 to 9 hours. In research, when left to their own devices, they usually average somewhere around 8.2 to 8.7 hours. And we know that a large majority of adults, particularly in America, do not sleep that duration. So a lot of people are already a bit sleep deprived, and so are they excessively
Mm,
sleepy because they're untreated sleep apnea or insufficient sleep? In a lot of cases, it's both.
I see. So for people that think they might have obstructive sleep apnea, is there something that they can do like in the moment, right? If like without having to go and like go through a sleep study and such to know if they potentially have it. Anything they can do at home to tell that?
So, one of the things we typically like to do in sleep medicine consultations is if there's a bed partner present, that information can be very helpful. Bed partner may report they witness the person stop breathing, that they snore very loudly, that they're really restless. It looks like they may be struggling to breathe. So, information from bed partners is quite helpful. With the um, technology with wearable devices, Apple watches, Android watches, Fitbit one, Google, those types of things. Sometimes person may be getting notifications through their health app that's connected to their wearable device. There's also one known as the Oura Ring, OURA, that exists. And may be telling the patient that their rate is too high during sleep. Normal heart rate during sleep is 40 to 90, which can be a sign that they're struggling to breathe. Or in some cases, if their oxygen is dropping, normal oxygen saturation is 88 to 98%. Typically, moderate and particularly severe sleep apnea, it can be below 88, sometimes well below 88, which is quite detrimental to health. Interview with their primary care provider if they have one. And we understand a lot of people don't have access to that, but there's online quick screen that's called the Stop Bang score, STOPBANG, can be Googled. And if a person has a score of 3 or higher on that, they likely do have sleep apnea. Definitely would be appropriate for them to be referred to a sleep medicine clinic. It can be a bit difficult to get in sleep medicine clinics for testing because of either demand or sometimes insurance referrals are required, and that can be a barrier.
Mm,
But some
yeah,
of those methods can be a way of kind of figuring out, I think this person may have sleep apnea or something's not right here, and trying to get it looked into in a little more detail.
I see. So yeah, just to summarize that, so definitely wearable devices that a lot of people seem to commonly have be helpful, or using a bedside partner as well to see if you stop breathing. Two good ways to tell that. Okay. So for the next question that kind of piggybacks on that, how does obstructive sleep apnea affect your physical and mental health?
Well, it can have quite profound effects. And so, searching on a reputable medical website, not all information on the internet is necessarily reliable or reputable, will show that untreated sleep apnea is quite harmful to health. It contributes to earlier death, contributes to difficulty with developing or controlling diabetes, which is quite common. It impairs ability to lose weight. Hypertension or high blood pressure is a common symptom of untreated sleep apnea, particularly if it's moderate or severe and the person's having a difficult time controlling their blood pressure. Um, Cancer risk is increased with untreated sleep apnea, sadly. In the mental health or behavioral wellness realm, a lot of overlap between various sleep disorders, namely sleep apnea, the most common sleep disorder that we see, and mood or depression, sometimes anxiety. The person's struggling to breathe. They're releasing a lot of fight or flight or stress hormone in the form of cortisol, particularly in the latter portion of their sleep period when they're dreaming, and people tend to struggle even more to breathe. And they have a lot of cortisol circulating around in their body, and they awake and they feel anxious. And sometimes folks will wake up with a headache in the morning, which can be a sign of obstructive sleep apnea, plus a slightly more concerning condition is hypoventilation, where they're not effectively not only getting enough air in, but not getting all the waste air out. And they'll have a headache that after they're awake and breathing normally for 10, 15, 20 minutes or so will typically go away. and that would definitely be a symptom that would be of concern as well.
So, yeah, quick question on that. So, when you just mentioned hypoventilation, so would that basically mean like just a buildup of like carbon dioxide then, since you're not effectively breathing all of that out?
Yes, and there's a lot of people that have untreated severe obstructive sleep apnea, and some of them it's so bad that they also have hypoventilation on top of that.
Mhm.
Sometimes they end up hospitalized, and we're working in our inpatient service to identify and diagnose those folks and get them on treatment to help keep them from going into potential respiratory failure. Now, not everyone with sleep apnea is on that path, but in the
Yeah,
more severe cases, it can be. And there's something I wanted to mention is children. I had mentioned previously that it can be kind of hard to get into sleep medicine clinics. One symptom of untreated sleep apnea is ADHD symptoms in an adult or a child, and we know that's a common childhood concern, ADHD or attention deficit hyperactivity. And those patients, particularly pediatric or children, are prioritized at sleep medicine clinics. Typically, a child that has sleep apnea, it's because of large tonsils. Sometimes it's kind of watch and wait. Sometimes it's a go ahead and electively have the tonsils removed. The procedures that are done now are a little different than what was done several decades ago and prior. And so that can be of concern and can contribute to an ADHD type picture.
I see. So one of the questions I especially ran into, especially when it comes to what you mentioned, is weight. Because it seems there to be actually quite a few like skinny people that actually have obstructive sleep apnea. So say if you are, on the slimmer side, like if you are having trouble sleeping at night, does that exactly correlate to sleep apnea? And if it is, like what is causing that exactly?
So typically with overweight people, a large neck or a lot of extra tissue in the kind of the neck area and the upper part of the airway contributes to sleep apnea. However, yes, people that are not overweight can also have moderate or severe sleep apnea. Usually it has to do with kind of the anatomy of their airway. It may be a little narrow in towards the back of the tongue where the throat is. Um, Another common group is those of Asian descent, particularly because of a little bit more of what we refer to as mid-face hypoplasia, or a little bit of a flattening of the cheekbones. Not unusual for folks of Asian descent to have, in some cases, severe range sleep apnea without being overweight at all. And so those are usually still treated the same way. Sometimes a corrective surgical procedure, which is not really routinely done for any form of sleep apnea, no matter what the cause is, because of some limitations with long term success. Although there's some implanted stimulator devices that look like may actually be fairly effective, but they're still only indicated for people who have actually failed tried and true treatment, usually in the form of some sort of positive airway pressure. And then, it just depends on the person.
I see. So for those that are experiencing like, symptoms now and aren't able to get, treatment because they have to wait a couple of months down the line, what are some effective ways to cope with obstructive sleep apnea like on a daily basis with like the mental and physical effects?
But a lot of folks are already doing it on their own because it's their method of surviving. Two characteristics of being alive are having a heartbeat and breathing. And so part of the problem here is breathing is not happening like it should at night. So typically, a person will sleep with their mouth open. They'll have a difficulty sleeping on their back or will just not sleep on their back at all, which is okay until maybe they start having shoulder or hip problems that could happen later in life. And then it can really become more of a urgency. Um, and sometimes there will be an extension with their to kind of help open their airway, particularly in children. We'll ask, is there strange sleeping positions where it looks like they're trying to get into a position where they can breathe? So those are pretty common ways that people are getting by with untreated sleep apnea. Sleeping upright in a chair, recliner, because a person can't breathe when they're laying down can be another symptom, particularly in the more severe cases.
So are there any say like third-party devices or things that people can access in the meantime, whether it be on I seen dental appliances that people can use or like chin straps, like stuff like that that you would say is effective.
Most of them require some sort of order or prescription from healthcare professional, dentists who have been trained in sleep medicine or dental sleep medicine, which the routine dentist does not. Can in some cases fit an oral appliance, typically for insurance coverage for an oral appliance. The prescription's required from a sleep medicine physician. So once again, access the care barrier for that can be quite common. Um, and really, the oral appliances are really only recommended for folks with mild sleep apnea, which is less than 15 interruptions per hour. Anything beyond that, they're really not indicated, although some folks will try to manage with that. Things like a bite guard, which can be obtained over the counter. By the way, bruxism or teeth grinding can be another symptom of untreated sleep apnea, although it's not specific. And the use of a bite guard actually does not necessarily help sleep apnea, although it can help with some of the damage that can occur to teeth. There are a number of what I call rabbits that we pull out of the hat in the sleep medicine clinic. There's a device that helps pull the tongue forward with a kind of a vacuum type mechanism. There's little stickers that are kind of one-way air valves that can be placed over the nose where the person can inhale in, and then it kind of prevents them from exhaling out, and it helps increase some of the pressure to help open their airway. Also require an order, uh, and not dramatically effective. Sadly, over the counter, outside of um, uh, there's just not options available.
I see. So I guess from uh, treatments that they can obtain to get like I guess more that's commonly used treatments and such like CPAP devices, like what are the most effective forms of treatment? Is it usually like CPAP or are there other methods of treating obstructive sleep apnea that are effective as well?
Depends on the patient and the severity. So, for example, I'd mentioned earlier in children, usually is enlargement of the tonsil, sometimes the adenoid tissue, which cannot be seen easily. It's more kind of behind the nose and not something you can see when you tell them to open their mouth. If they have moderate or severe sleep apnea, a lot of times they'll undergo surgical correction of enlarged tonsils, i.e., removal or adenoid or both, and that can be curative. For adults, it's usually not tonsils. Most adults have reduction in the size of their adenoid and tonsil tissue in late adolescence, early adulthood, and so that's not a typical cause. And treatments most tried and true to date are still positive airway pressure. Now, there's been a lot of innovation in devices over the recent decades, particularly the last decade, just like with cell phones and cars and other technologies. And so they're become quite easier for people to tolerate and wear. Usually, a form of continuous positive airway pressure, which is known as CPAP, that is auto titrating, so we call that auto CPAP, is the first step, depending on the severity and the patient. In some cases, people may do a little better on a slightly different version of positive airway pressure known as bilevel positive airway pressure, BiPAP, and sometimes we tease that out and we'll prescribe that. Patients doing better. And there are several different versions of BiPAP devices that can even treat more complex sleep apnea issues, including things like central sleep apnea or hypoventilation, in addition to the obstructive sleep apnea. So typically a automatic self-titrating machine, which has been the latest and greatest, works the best. And a lot of folks start there and are happily ever after. Some folks need a little additional or something slightly different. We can help figure that out. Outside of that, we start looking at some different devices, including an implanted stimulator device that can help push the tongue muscle forward that is appropriate and effective for some subsets of folks. And surgical procedures in adults are less likely to be successful. And so, unless there's something really specific, maybe the person has a really large tongue, like we can see in some Down syndrome cases, things like that, there might be an intervention that can effectively treat or reduce. A lot of folks, if they lose body weight, can decrease their severity. And in general, if someone's lost 10% or more of their body weight, maybe from a gastric bypass or with medications, particularly with some of the newer agents that are being used now that were traditionally used for diabetes but are helping people get weight off. We may revisit what the severity of their sleep apnea is. It doesn't always go away, but sometimes it can make their treatment a little more comfortable if they're having problems with that, or in some cases, maybe a little bit more of a take it or leave it because they've lost enough weight that their sleep apnea is essentially normal.
Okay. So most patients will, their first step is going to be using CPAP. Um, so you also mentioned BiPAP. So does that basically mean, I mean, bi, obviously meaning two, so two different pressures for breathing in and breathing out, correct? How many
Yeah,
patients would you say move on to that next step from there? And is it usually more expensive to go that route if like regular CPAP isn't working for them?
a minority of folks. And so usually that's the person that is on CPAP and they're moving air in and out, but maybe they're having some tolerance issues. Maybe they're a little bit higher into the pressure range. Not everybody that's on high CPAP pressures needs to switch to BiPAP. In some cases, we'll bring them in and actually do another sleep study in a lab to kind of see what they look like, have them complete a questionnaire, and they may look better. You think, well, if BiPAP's better, why don't we just start that for everyone? They're not that much more expensive. Well, not everyone feels more comfortable in BiPAP. And so, with the
Mhm.
tried and true for the majority of cases still being CPAP, and I would say the percentage of folks who transition from CPAP to BiPAP is less than 10% for just routine obstructive sleep apnea, then, and the consideration that not everyone actually feels more comfortable in BiPAP, we don't automatically just jump to that. But that is one of the rabbits we pull out of the magic trick hat for folks that CPAP's not quite working ideal for them, auto titrating CPAP, and can have good success with. However, I will state once again that the overwhelming majority of obstructive sleep apnea patients who have found access to care, once again, big barrier, are aware that they have sleep apnea. I should say that approximately 80% of people who have sleep apnea are not aware that they have sleep apnea. And about 3 out of 7 Western adults have sleep apnea, 1 out of 7 severe enough for treatment. If it's mild, it doesn't always have to be treated, but it should be diagnosed and effectively clarification of the severity.
Mhm. So I guess in terms of effectiveness, like yeah, CPAP is yeah tried and true for it, but there's also more invasive procedures as well. Are how are those compared in terms of like their effectiveness, like long term for treating their conditions? Is that something worth considering for so like your average like CPAP user if they don't like using the machine?
Well, there used to be a procedure known as what is called a U triple P, which involves quite a bit of surgery in the throat area, including removal of the uvula, which is the little part that hangs down at the roof of the mouth towards the back, and also could help maybe widen the airway. And sadly, the long term success rate at 5 years was 16%. So it really fell by
Mhm.
the wayside, but it's not uncommon, particularly for an older person, to have known someone that may have received a U triple P procedure, 80s or 90s, for treatment of sleep apnea. And then they ultimately end up needing to be treated with something like positive airway pressure, usually in form of an auto CPAP later
Mhm.
on. And in some cases, it's even worse because of scarring. Plus, the procedure was painful and had a bleeding risk. And also of interest, the ENT literature shows that folks that actually have sinus concerns, chronic sinus issues, don't necessarily do worse than positive airway pressure treatment. Some may have an easier time tolerating if they have problems with like enlarged turbinates, which are some parts inside of the nose area, or a deviated septum. Maybe they sleep better on one side than they do the other. Usually the high side is the good side. So if they can't really breathe through their right side very well, they may find themselves sleeping either on their back or on their right side so that they're breathing in and out that way. So there can be consultation and potential surgical correction, but it's not the routine, and it's very patient specific, and it doesn't always result in success.
Mm. Yeah, because it seems like a lot of patients are more or less searching for a cure, if you could call it that. Because having to use a machine long term, it to some people it definitely is more of a turn off and such. So is there truly a way to cure obstructive sleep apnea, or is just using a CPAP for the rest of your life really the most effective way to mitigate a lot of the symptoms that come with it?
In a lot of cases, the use of some sort of positive airway pressure is going to be the most effective way to mitigate. Even folks who lose more than 10% of their body weight, in a lot of cases, still need some sort of assistance for their sleep apnea treatment. It doesn't always go away. Clean cases like the child that has large tonsils and they're removed and then they're cured, although they are at higher risk of developing sleep apnea later, and sometimes they may get several sleep studies throughout the remainder of their childhood or later in adulthood, are probably the cleanest example of a cure, if you will.
Yeah,
The other methods have not really been shown to have a high curative rate, if you will. And so we're still here in this realm of positive airway pressure devices being the most effective and usually the best tolerated treatments for something that in almost all cases is some sort of lifelong condition. Maybe the severity ranges a little bit depending on the person's size or other medications they may take or other health issues they may have or improvements in their health for that matter.
I see. So it seemed like it's going to be more of a battle of mitigating I guess the circumstances that will lead to having more severe symptoms and such. So there are things people can do in the meantime to I guess alleviate those circumstances long term. So okay. So to leave off on that, are there any effective like educational resources that people can access to maybe act like if they don't know some of the like medical literature and such to go and read up on it, like effective sources that you found online and just throughout your practice and such?
Absolutely. So, reputable or good information on the internet can be variable. Good resources for sleep information that's written at a consumer level are places like the National Sleep Foundation, which I would highly recommend, and has lots of great information about sleep apnea as well as other sleep disorders, which are less common. The American Academy of Sleep Medicine, and then WebMD can be reliable. There are other reliable information sources. Starting with the National Sleep Foundation is a good place to go, and also opening up the discussion with primary care provider and subsequent referral. And sadly, in a lot of primary care situations, if a person even has access to one, the time can be a bit limited. Usually, there may be other more pressing matters are discussed, and sleep gets pushed to the back burner if it's even on the stove at all, if you will. And people can go for many years with untreated sleep apnea and think, well, I just always kind of feel crummy when I wake up or always tired during the day. And then something really terrible happens, like a heart attack or a stroke, and all of a sudden the untreated sleep apnea is more recognized and trying to do something about it. Sadly, it's not necessarily harder to treat in those cases, but it's more unfortunate because potentially the negative thing that happened could have been prevented by earlier identification and treatment of the sleep disorder.
Mhm. So I'll definitely link all those resources that you just mentioned because they're definitely going to be a big help. Um, so yeah, I
And I
appreciate
would also put a link to the Stop Bang score, which is a
yeah.
screen that can help people identify if they're in the higher risk sleep apnea category.
Okay, yeah, we'll definitely do that too. Thank you. But yeah, I appreciate you taking the time to sit down with me and talk. I guess for finishing remarks, um, just for all different patients I've talked to and asking about their symptoms and such, it definitely seems like there's a lot of distress and like a need for good, reliable information out there. So I'm hoping through this interview and such, they can maybe hopefully get some good information out from it and take it from there and such for addressing or going on their own journey to get treatment and such. Guess David, do you have anything to leave off on?
Absolutely. If a person suspects they have sleep apnea, the bed partner is reporting interruptions in breathing, they feel really tired during the day, and they are allowing themselves enough time in bed, even if they're not allowing themselves enough time in bed, given how common sleep apnea is, particularly if they're on the larger side, shall we say, should really be thinking about sleep apnea. It has very terrible long-term consequences over time and trying to find a way to do something to improve their breathing at night. And that can make people feel exceptionally better. It's not an uncommon story in sleep medicine clinic for somebody to think, well, I just always kind of feel quasi terrible, if you will. We identify their moderate, severe sleep apnea, treat it, and they feel like an almost completely different person. They're less irritable, maybe less depressed, more energized, better problem solving ability, better overall function. If folks are interested in reading a book written at the consumer level, there's a very renowned sleep researcher by the name of Matt Walker who's published a book, Why We Sleep. It does go into other types of sleep disorders, but has very compelling information from some of the studies that he's done showing how interruptions in sleep and how negative it can be. So I would encourage folks to think about maybe reading that if they're interested in learning more about their sleep.
Okay. Yeah, and I'll definitely leave a link to that too. That sounds like a good read. So, okay. Yeah, appreciate your time, David. And yeah, we'll leave it on there. And until next time.
Take care.